Dear friends, truly a miracle. So last week when I was taping, I said that I had a respiratory problem, and it wasn't because I came to the emergency that very day, and it was an aorta dissection that went from my heart all the way down to my groin.
Aortic dissection is tearing of the blood vessel that leaves the heart and supplies the entire body with blood flow. This disease, if it is not operated promptly, more than half of patients who have it will die within 48 hours. The tear of the aorta could cause sudden death from a variety of causes, and that's why when someone has this, we try to get them here as quickly as possible and to the operating room as quickly as possible.
So luckily they cut it on time, replaced a portion of the aorta, about 5 inches worth of it. Interesting surgery because they're stopping your heart, kind of put you on ice, stop your lungs, pretty wild stuff. The technology that we have today is unbelievable. So I guess God wants me longer out here with more plans. I'm not done yet, so I'm looking forward to being with you a little more. Thanks. I'm recuperating quickly. I'll show you the saying, yeah, there's a very, very fast recovery that I'm having. So I know that a lot of it is because of your prayer. Love you. Bye. Today is day 3 after surgery. They just remove the drainage from the lungs, the 3 different tubes, and also the apparatus that was going to the heart. So that's great. Much less tubes. Okay, finally, I want to give you a recap of what has happened. We're almost on day 5, another 5 hours. But yeah, they will release me. Unbelievable. They will release me today. So that is something crazy in itself. Even the doctor said, I've never seen anything like this. My friend, I'm here with a doctor that saved my life, literally. The doctor saved my life. And, she was just telling me a few things about what happened. So go ahead and share some of the procedure and, the recovery and so on.
Yeah. So, you came in with an acute type A aortic dissection, which is a life-threatening emergency. And usually it's a really big struggle for patients to get through that surgery. There's a high mortality, but then it's also usually a really prolonged recovery process. But you have seemed to kind of defy all the odds getting out of the hospital 5 days after this major operation, which is probably a world record in and of itself. I don't think I've had any patient get out of the hospital that soon after a dissection repair. So overall,
thank you so much.
You've done amazing. We've all been cheering for you.
Thank you so much.
We're happy to see you do so well.
I appreciate it. Okay. So a quick recap of what happened, because many of you have asked, about what happened. So I did a workout, over 2 weeks ago on Thursday, and afterwards, my head was feeling light, so I did a Valsalva maneuver, when you're pressing down, bearing down, and as soon as I did that, tremendous burning right into my chest, going down in my esophagus, my bronchioles, down into my stomach, radiating into my kidneys, and locking my legs. So I decided, okay, let me take it easy before I drive home. Got dressed, went home, and I checked my blood pressure and it was very low. I had 92/51. So I figured, okay, the lightheadedness is because of the low blood pressure. But then within maybe 2.5, 3 hours, it skyrocketed the other way. So my systolic jumped up to about 152, 153. And the pain did not subside at all. And in the last video, I was talking about maybe having this pulmonary problem. Well, it wasn't a pulmonary problem. So bottom line, I endured the pain for about a week. And then finally I decided, let me go to the emergency room because I was home by myself. Also, Jane had to go and take care of the twins up with Marco. And when I came here, again, the miracle in itself, the doctor that checked me in decided to do a CT scan right away instead of doing an X-ray. And so when he got the results, he showed me, he said, well, you have an aortic dissection that starts from the base of your heart, and it goes all the way down into your inguinal area, your groins. And I said, well, what do I have to do? So first of all, it's a miracle that you're alive, because the mortality rate is about over 50% in 48 hours. And I've been going for a week. And second, he said, we have to operate immediately. You know, we're setting up the room right now to get you in. And so your mind start wondering, you know, I'm in Chattanooga, you know, is this the right hospital? Do they have the right people? Maybe I should be going up to Nashville. Anyways, your thought process is just going crazy during, you know, that time when you're hearing this kind of news. But then the surgeon came in, a nice gal, trained in Alabama, and she went over some of the complications. She also told me that 25% of the people died during surgery. So mortality rate, you know, high everywhere you look at it. And I went into the room, and you know, they prepped me. Well, enough fun. Here I am in the operating room. I'm gonna do surgery any second right now. And is aorta dissection, so it's not gonna be fun. Big cut, 7 hours, but you know, we are in God's hands, so it's gonna be cool. Ciao. And the crazy thing is that they put you on these artificial machines for about, well, in my case it was 4.5 hours, where my heart was stopped, my lungs were deflated, so they bypass everything in order to do the surgery itself. And that's it, pretty much in a nutshell. Now the recovery is great. I did have a problem sleeping. I couldn't sleep at all after they brought me back, because I had so much adrenaline going, cortisol going. They gave me some melanin, and it wasn't doing anything. It wasn't good enough. So finally last night they changed drugs, and I had a great night's sleep. And I also prayed specifically, and I asked for prayer that I would have a good night rest. And I know that it was from the Lord, because the dreams that I had were just unbelievable. You know, I was actually doing evangelism in a cave, believe it or not. And my daughter was there, my wife was there. And anyways, I know that the Lord was with me during those dreams. And I woke up refreshed, you know, full of energy. So now I'm going to be released hopefully in the next hour and a half. And I know that this speedy recovery that, again, seems to be so unusual. You know, they want to do a video on it. Actually, they asked me to do a testimonial, you know, next week. Is attributed to definitely your prayers. Well, you got to be in shape as well, but the prayers are definitely the marker. So I want to thank you personally again for your prayers, for your support through this process, and I love you, and I'll catch you next time. Ciao.
Out of here.
On the game,
And he was picky about his outfit.
Yeah, got an outfit. Hey, let's remember the dog, guys.
All right.
Whoa, sorry.
Can you guys get the rest of the stuff?
Te fa toccare?
I need to go.
I can get the bag.